So the question we got, because of it being close to winter, we're getting into a more of a drier time of the year. And by the way, we live in Pueblo, Colorado. It's a very dry place anyway. What happens when my feet start cracking or when I start having pain associated with these cracks and it's just dry? So it's a very good question, and it can happen actually not just during the winter time, but also we find with patients that are in flip-flops or sandals a lot during the summertime, they end up having a lot of cracks, especially around the heels. So what we do is provide an emollient. An emollient, the word is a moisturizer essentially to try and counteract the dryness then that's occurring and causing these fissures. What can happen is they can get so dry they can start to even bleed and become very painful. For those, there's several different tacks that we take then when they get that bad. If it gets to the point where they're cracking to the point that they're bleeding, we recommend that patients use the Gorilla Glue that works the best. It's more malleable as you're walking. It doesn't crack even further like a super glue would. And so using this, the Gorilla Glue to seal up that fissure, and then you need to start using something called a keratolytic. You're familiar with the term keratin. Keratin makes up hair, it makes up skin, it makes up nails. Keratolytic you want to use on the area where you just use your super glue. So you would then apply the keratolytic, and these can come in different forms. The ones that we have here in our office are Kera 42. The 42 is the percentage of urea that's in the cream. The urea is the keratolytic. Also, we have a product called Kamea. And the Kamea G stands for glycolic acid. So both of those are keratolytics that we use in varying strengths. And I'd recommend coming in to see us to determine which one we would recommend. After you've used the keratolytic on your foot, then the next time you shower or bathe or soak your foot, I'd recommend using a pumice stone. Afterwards, and that way you can remove that excess callus or skin or fissure that is now ready to come off having you use the keratolytic. Then before your skin's completely dry, reapply either the Gorilla Glue again if you feel like it needs it, or apply the keratolytic if you don't feel like it's open anymore or it's not bleeding. If you do not keep that fissure closed, then applying the keratolytic in an area that's really tender or exposed or bleeding will actually make it feel like it's burning. And so you need to make sure that's closed with the Gorilla Glue. Otherwise, just a regular lotion to prevent all this from happening in the first place. The one that we carry here is the Amerigel Care Lotion from Amerx. It's a very good one. We found it works very well for patients that are on dialysis or have diabetes. There's also Cetaphil, Cetaphil. We do not carry that one here in our office, but you can find that in most pharmacies. So that's the answer to that question, and I hope that helps.